Welcome to the cutting edge of healthcare. Today, we explore the real-world impact of AI beyond algorithms and enterprise systems by sharing stories of how these tools have helped us personally. In this episode, we peel back the technology and get personal. Because when it comes to health, AI isn't just about automation, it's about access, advocacy, and awareness. Before we dive in, let's meet today's panel. Karen, would you like to start?
Hi, I'm Karen Vincent, a product leader with more than 10 years of experience in data-driven decision-making and digital transformation in healthcare. My focus is on readiness, governance, and performance metrics, helping organizations unlock the full potential of AI to improve patient outcomes and operational efficiency. I'm excited to share insights on how to effectively measure the impact of AI in healthcare and navigate its challenges. I'm delighted now to introduce Prerna Anand.
Thank you, Karen. Hi, everyone. I'm Prerna Anand. I'm a product manager with over a decade of expertise building products for patients, providers, hospital systems, and payers. My focus has been leveraging artificial intelligence and machine learning to build such products. I specialize in uncovering the real problem underneath the symptoms faced by a user and delivering the most optimal solutions that work for them. My superpower is translating user speak into technical requirements and vice versa, which is very pertinent in the world of AI, where spoken word is now the code. Thank you for leading us through this episode, Angel.
I am Angel Shew, a champion of digital transformation that drives proactive care and enables every individual to attain their highest desired level of health. I've spent over 20 years in driving care transformation in some of the nation's largest health systems, including UCSF Health, Stanford Healthcare, Kaiser Permanente, and most recently, Medical University of South Carolina. What excites me to wake up each morning and go to work is turning tomorrow's healthcare technology into today's working reality. Karen, tell us about your story.
Yes, thank you, Angel. I want to tell everyone about how AI helped me advocate for my vision. So in early 2024, I woke up in excruciating pain in my left eye. It felt raw, burning, and I could really barely see out of it. I rushed to my doctor. She diagnosed me with dry eye. I trusted that judgment, followed the treatment plan, but the pain really didn't stop. Fast forward to January 2025, and the pain was unbearable. I lost sight in that eye, and my doctor confirmed that my cornea had eroded.
Oof.
So this time, I had a different approach. I used AI tools like ChatGPT and Perplexity, and I researched corneal abrasion, recurrent erosion, and learned about some of the treatments they were suggesting and the bandage contact lens. And the most important thing in this case for me was that I learned that these bandage lenses should remain in place for weeks to provide enough time for healing, not the 48 hours that the doctor had initially suggested. So, being armed with this knowledge from my research, I was able to advocate for myself and I received the care that I needed to heal. And if I had had the AI tools sooner, I might have actually avoided some of that unnecessary pain over those long months. Using AI tools didn't just help me understand my treatment options and why the surgery I eventually had was the right choice. It gave me the language and knowledge I needed to advocate for myself. And honestly, probably saved my vision. Perna, I believe you can relate.
I definitely can. Misdiagnosis is such a pain, and I'm glad that you're feeling better, Karen. I have a similar story. It's about the pain no one could see. For almost 8 years, I lived with a sharp pain under my shoulder blade that started after a car accident. Witnesses called it a rear end collision, but I got hit from the side because of how I was sitting. Every doctor told me it was nerve pain from trauma. I went through nerve blocks, therapies, painkillers. Nothing worked. At one point, one of the insurance adjusters even suggested I was just out to get money by exaggerating how painful I was. If I had AI tools back then, I would have started by asking ChatGPT something like, hey, I've had chronic pain under my shoulder blade since a side impact car accident. It doesn't follow the nerve path and hasn't improved with treatments. What else could I discuss? That might have helped me learn about words like rhomboid strain or scapular dysfunction and the language to advocate myself. Next, I would have gone to open evidence and asked to find clinical studies linking rhomboid or scapular injuries to side impact or rear end car accidents. That search would have given me evidence that these injuries are often overlooked, especially in women, and proof that I wasn't imagining things. If I had access to Google Health I might have said, hey, Google, give me localized upper back pain after a side impact crash or with normal nerve tests. What muscles or joint injuries are most likely? And I could have surfaced rhomboid tear as a possibility years before any doctor thought to check about it. And finally, I would have asked Claude to help me write this message for my doctor by saying, help me summarize my medical history for my doctor in one paragraph with clear, factual, and not defensive words. What this would have done for me was I would have had the right language to talk to my doctor and then may have found my cure much, much earlier in my journey. Because sometimes being heard starts with finding the right words. What do you think, Angel?
Perna, that story is such a great example of how AI can give patients what we often lack, which is the right words and evidence to be taken seriously. Especially when pain is invisible, that kind of validation can change the whole care experience. My story isn't about me, but about a close friend. He was visiting from Hawaii, staying over, when his heart started racing. He's been diagnosed with AFib, but hadn't seen a cardiologist yet. It was late. We were panicking. So I turned to open evidence and asked, what AFib symptoms require urgent care? What foods or activities should be avoided while waiting for treatment? We learned what to watch for, how to calm the episode, and when to call 911. We removed a red wine from the picture, ensured he rested, and monitored him through the night. AI didn't replace care, but it brought us clarity, calm, confidence, in a moment of chaos.
Wow, I'm so glad that you were able to use these AI tools to have peace of mind when your friend was visiting. AI is just a great tool to have in a tool chest as a patient, friend, or caregiver, especially when navigating complicated medical conditions. Sometimes our doctors are overwhelmed and too busy to even consider the whole constellation of symptoms we're presenting with. And AI helps patients focus, find the right words, and be prepared with the best questions. The AI tools we mentioned today could have helped us find answers sooner or speak up with confidence and simply feel better sooner, get our treatment going more quickly, and maybe even save us some pain. The value to patients is about bridging communication gaps between providers and patients and building access, advocacy, and awareness.
Very well said, Karen. These dudes don't replace doctors. They're never meant to replace doctors. They give patients something we've all struggled with at least once: words, evidence, and direction. AI can't heal you, but it can help you be heard. When we talk about the promise of AI in healthcare, this is it. It's not replacing expertise, it's amplifying the patient's voice.
In listening to all of our stories, I realized we share something profound. How AI helped turn uncertainty into understanding. For example, Karen, it protected your vision. For Perna, it helped you reframe years of unexplained pain. For me, it offered clarity and calm in a moment of fear. That's the power of AI. It shines light where patients have long been left in the dark. As more patients and providers embrace and use these tools, we're entering a new kind of care dynamic, one where information is shared, not siloed, and where empathy remains the most powerful tool of all. Don't miss our next episode where we explore how today's AI agents are reshaping real-world healthcare. Until then, I'm Angel Shew.
And I'm Karen Vincent.
And I'm Prerna Anand, signing off from Principles of Healthcare. Remember, the future of healthcare isn't just about building smarter systems. It's about building systems that make us all better patients and better caregivers.
This AI-IRL episode of Principles of Healthcare is produced by Prerna Anand, Karen Vincent, and Angel Shew. This is Volume 1, Episode 3, When Health Gets Personal. Media editing by Karen Vincent. Background music, My Artificial Intelligence. Audio source, Music Revolution. Licensed through Adobe Stock. Stock footage by Visual Lab. Licensed through Adobe Stock. Special thanks to our listeners, mentors, and the healthcare community for your support. We'd love to hear from you. If you have questions, topic suggestions, or potential guest recommendations, please visit bit.ly/AI-IRL. Stay connected. Follow us on LinkedIn. You can use the QR codes on our credits page to connect with Prerna, Karen, or Angel. This is Karen Vincent signing off. Thank you for listening.